Step Care 2.0 is a little bit of a mix of both. It's a flexible, progressive step care approach. And at the practice level, it's a systematic and flexible approach or system to address the client's mental health and chronic pain needs, taking into account their goals, their preference, their needs, and their readiness. It's very important to start from a person's goal and readiness, because even if somebody might have very severe symptoms, they might not actually be ready to engage in more intensive treatment. And Step Care 2.0 is also anchored into recovery principles, which actually I will speak about briefly in a minute. And it favors solution-focused and strength-based, lower intensity interventions whenever that's possible. That being said, it does not prevent access to higher intensity treatments if that's what's going to meet the person's goal, and if the person is ready to work hard. And the way that we make decisions on stepping up or stepping down treatment is through the use of continuous outcome monitoring, where every now and then at regular interval, we ask the person to complete some self-assessment to help orient the next phase of their treatments. Now, I've talked about Step Care 2.0 at the practice level, but for health administrators at the system level, it's really about coming together with people with lived experience, clinicians, researchers, to transform our health system by developing, delivering, monitoring, and adjusting the programs that we have to better meet the needs of people of the needs of all people who live with chronic pain. So not just the people who can and have the tolerance to complete an 80-hour intensive program, not just people who will respond to interventional management, but really for everybody. So with Step Care 2.0, there are really 9 levels of care. Somebody might just at first benefit from learning more about chronic pain, having some information about the difference between acute and chronic pain and best approaches in their management. Somebody might be actually ready to start taking some online courses at their own rhythm and to see what they can learn really on their own. But somebody might actually be interested in meeting other people that have lived experience of chronic pain and learn from their experience. And there are many peer-led self-management programs across the country that people can access. Someone might instead want to take on participating in some workshops that are delivered by a clinician who's been studying and working in the area of chronic pain for a long time. Somebody may feel like, hey, I'm doing this self-management course online on my own, but I need a little bit of help. I need some troubleshooting. And then you can actually schedule 5-minute, 10-minute, 15-minute coaching session in order to help troubleshoot whatever issue is coming up, maybe with pacing, with energy conservation, with making some, implementing mindfulness strategies, or any questions a person may have. And if somebody is really struggling with something specific, they're ready to get into it, they might be able to participate in group therapy for specific concerns, and I'll share about some of the groups that we offer at the pain clinic. Or they may be ready to participate into a more intensive interprofessional chronic pain rehab program, and we have a few of those available throughout the country. And finally, in terms of the 2 last steps, if they need one-on-one treatment, then that can be scheduled in. And if they're really struggling with managing day-to-day activity, with keeping straight all of these appointments, assessments, they might actually benefit from a case manager who will help them navigate this and access not only the healthcare system, but also community resources in order to better achieve their goals.